So today I'm going to go over some foam rolling. I like foam rolling for the fact that you can give yourself your own massage. It feels good when you're sore, increases blood flow, and can be a really helpful tool if you've had a good workout and you're really sore, or you just feel like you have some aches and pains. Also, I love to do it for some spinal mobility, working on flexion and extension, a little bit of rotation you can do on it. So we're gonna get started. We'll go toes and then work our way up. Well, feet. You don't foam roll your feet, but that's the direction we're starting. So you can do one leg, which is easier because then you can support with your other leg, and you just work on those calves and go slowly up. When you find a spot that's sore, you can just pause there or just oscillate around that spot until it's not really sore anymore. Just kind of going up and down, feeling what needs to be worked out a little bit. I usually get sore more on my outer calves. You can do this both legs at the same time, but it's a little bit more demanding on your shoulders and your core to stabilize yourself. Try to do your tuck and keep your abs on so that you're not, making problems other places when you're trying to work other muscles out. So keep your core on, kind of push through your shoulders so you're not hanging out on ligaments. All right, then hamstrings, which I feel good right now. Same thing, you can do one leg, which I'm going to do. You can start on your lateral hamstrings, or your biceps femoris, from the knee, working all the way up to your sit bone. And that's where I'm feeling it today. And then back. I want to try to put as much weight through that leg as you can if you want a deeper massage. If you need a little bit lighter pressure, put more weight on your other foot. You can go all the way your sit bone, really get in those adductors or inner thighs, and then work your way down. So you're basically going inner, middle, and outer. You can do that on both legs. So I'm going to skip forward a little bit. I love to sit on my foam roll because you can get some posterior pelvic outlet massage. You can get a little bit, the glute max and a little bit of the deeper muscles. So if you sit, you can sit straight on it and feel your sit bones, and then kind of rock back and see if you find any soreness behind your sit bones. Rock forward, see if you find any soreness. And then on the outside, usually is where most of the soreness is for me. But I go to the top of my pelvis and just kind of get in that glute area. You can kind of just pause and sit there if it's sore. Piriformis you should feel in that middle glute area, all the way down to your sit bone. Around that sit bone might be a little tender. You have a lot going on right there, a lot of muscle attachments. So just be cautious. Don't overdo it. See kind of how it feels, and it should feel good, or maybe like a hurts so good pain, as some of my patients say, but you don't want to cause any pain. Okay, so once I kind of work the outer glute, that's when I go into my IT bands, which is my least favorite thing to foam roll because it's usually pretty painful. You just want to kind of take a scan of your body and how it feels. So if you get to your hip bone, you can cross your upper leg over. Keep those abs on so your core is supported and your pelvis is supported. And you just go down the side of the leg. And that's where you're gonna get your TFL more up here. And then it'll go into your IT band. You'll know when you hit your TFL. It's pretty tender. So it might not be too comfortable to be rolling it constantly. So if you just pause, try to relax there and breathe. Use your breath to relax. So if you're tense and you're holding your breath and you're bracing, you're not going to get as much effect out of this as if you try to just breathe through it, slow, controlled exhales, trying to let those muscles relax. I'm getting the spasm. So just do what you can. You can unload yourself with that front heel if you need to take some weight off, and then just go all the way down to the outer knee and then up again. And when you come up, you can start turning a little bit to get more lateral quad, which may also be pretty tender. And then when you get up, find like the front of your pelvis, and you're just kind of laying on the foam roll. So the foam roll is just kind of sitting in the front of your hip. So that usually feels pretty good. You get some hip flexors in there, a little bit of TFL, some quads, and you can just, start in the front, roll out to the side. Right here feels really good to roll. And then you can go into quads, put this down, by kind of doing this, using your other 3 limbs to support yourself, finding those sore spots and working on them. So foam rolling is kind of a little workout in itself, just supporting your body as you get in these awkward positions to work out other muscles. So just be aware of that, and that you're not hanging on your shoulders and just, you want to push through your shoulders and elbows so that you're using your muscles and you're not overstressing your ligaments. Another thing I like to do if my glutes are sore is sit on the foam roll at an angle. So if you think, so kind of like this angle, like from pubic bone to femur, because you can kind of get between the sacrum and your sit bone and get a little bit deeper massage in there. And some people get really sore in that posterior pelvic outlet, so that can feel really good. You might get a little bit of the obturators that are a deep rotator. Just kind of, this is an assessment in itself, just seeing what muscles are more sore than others and what you need to work on to keep everything balanced. So the last thing I'm going to show you is what I like to do for some spinal mobility. So if you're feeling like, you're tight in your chest, or you can't breathe, or you're just not getting, you're slumped over, you're not getting that, straightening of your spine, the foam roll is pretty good to allow you to work on some mobility. So if you start with the foam roll in your low back, just above your pelvis, you can see if you're tender there. Sometimes I'll lay here and just, bring my legs up and just kind of do this and see if my low back, sometimes that feels really good. Just rock back and forth. Do whatever feels good. There's a billion ways to foam roll. Okay, so then I usually can get some pretty good cracking, self-manipulation, starting in that mid-back. Find your paraspinals, your back muscles. If you're sore in that mid-back, this usually feels really good. And then I like to think of, you're kind of rolling over from the bottom of your neck to your mid-spine, Start out there. Just kind of gauge how I feel. And then I kind of open up, keeping my tuck. Open up and have that foam roll as your pivot point and get some extension in that thoracic spine. So if you let your whole spine extend, you're going to lose that core control and you're not going to be able to pull your ribs down as much to get a deeper stretch. So I tuck, keep my abs on, and then just think about opening up as I roll over it. You know, protect your neck. If you have neck pain, you want to make sure that you're supporting your neck and not pulling it up. Feel between those shoulder blades. Usually it's pretty tight in there. We carry a lot of stress up there. You can also just breathe. Because with that rib movement, with your breathing, sometimes you'll get some self-manipulation or cracking, popping in your spine. And so you can work different levels. If you find a level that needs a little bit of work, just kind of going down and up as much as you're comfortable. You should never go into any spinal pain because it's telling you that something isn't right. And once I do that, doing some stretching, just rotation in that spine feels really good because now you've rolled it all out. You have hopefully a little bit more muscle relaxation, which means that you're going to get a little bit more mobility when you go to stretch. So hopefully you learned a couple new ways to foam roll or work on some muscle soreness, some posterior pelvic tightness, some spinal tightness, and you should feel pretty good after you do some of those moves. Stay balanced.